هو
أي فندم.
Thank you, Professor Samer, for your nice lecture. I'm asking about the repair of meniscal repair in adolescence. Meniscal repair in adolescence. The proper timing, when I am late and when I am early. The proper timing, when I am early and when I am late.
The distal, I'm hard to hear.
Meniscal repair.
Meniscal repair, yes. In adolescence.
Yeah. Timing, the proper timing. When I am late and when I'm early, and when I'm early, what you do, and when I'm late, what you prefer to do much.
So the patient presents with a meniscus injury, which is usually a twisting injury. You get an MRI. If the MRI shows a bucket handle tear, then this child goes to surgery right away. There's no discussion, especially if there's locking. If it's a radial tear, if it's a small tear, less than 2 centimeters, and they have no mechanical symptoms, we wait. We wait for 6 weeks. If patients do not improve significantly after 6 weeks, we do an arthroscopy. And if a child has a peripheral component to the tear, we repair it. The Chicago group in Rush are repairing everybody, radial tears. Bucket handles, of course, beak tears, flap tears, they're repairing everybody. And there's some evidence that it does heal.
How do you repair the interosseous talocalcaneal ligament?
The
Interosseous talocalcaneal ligament.
So the interosseous talocalcaneal ligament is the most important ligament in a subtalar instability. There is a Japanese procedure where you drill through the talus and drill through the calcaneus and pass a ligament. I have never done it. I trained with John Gould, and what he does is, and what I do, is you still repair the calcaneofibular ligament, and then you do a Gould modification. You bring the extensor retinaculum and repair it to the distal fibula. So I do a Brostrom Gould, and it stabilizes the subtalar joint at the same time. But there is a Japanese procedure that is described in the literature. I don't know anyone that does it. Yes, sir.
About the meniscal tears follow up by MRI. Is it when we follow up a case with meniscal tear, we don't have a clue. We have it's always the lesion is there. How you follow up the meniscal tear by MRI?
Do you mean follow up after repair or without surgery?
After repair.
So there are 2 papers that looked at healing of the meniscus on an MRI. An old paper by a guy called Metava. And he said you cannot predict an MRI repair on MRI. But there is a recent paper out of HSS, Hospital for Special Surgery, by Hollis Potter. Potter is her name. It's 2014. And she says that you can detect healing and you can detect stability in a meniscus on an MRI. Look it up, AJSM, Hollis Potter, 2014.
Any more questions? Thank you very much, Dr. Samer. It's been a pleasure to have you with us.